Hey everybody, John Schumacher here with NewWaveHealthcare.com. Today my guest is Dr. Kourosh Parsapour, who is the co-founder of a digital health startup called the personalRN. And Dr. Parsapour has come on the show today to tell us a little bit about himself and his current startup. So Dr. Parsapour, thank you so much for your time today. Let's have you just start out, tell us a little bit about you personally, because we want to get to know you, and then let's jump into your business.
Cool. Thanks for having me, John. And first and foremost, we got to skip the doctor stuff and go right to Kourosh and John.
All right.
So let's keep it informal. So personalRN, what we're doing is basically we're developing a mobile health solutions for the patients that are as they're being discharged. There's a lot of patients that end up getting readmitted, and the reason for that is basically there's not enough education and coordination of care on discharge. And what happens is the patients don't really get the information that they need. They go home, they don't really know the resources that are available to them, and they end up bouncing back. We're starting with stroke as our first app, and hence the brain and the logo. And basically, our app is reimagining a lot of the information that's already out there, but providing it to the patients and their caregivers in a way that's really digestible. So it uses where they are in the care setting in the hospital, so the ICU, the floor, and uses that environment to address a lot of the common questions that they would have regarding that environment, as well as providing education regarding that specific disease to make sure that they're learning it in a way that prevents them from coming back to the hospital. So the patients do better when they leave, and it decreases readmission. So it's a huge cost savings for the hospitals as well.
Right, right, yeah. So it's basically an application. Is it an iPhone app, Android, iPad?
So we're iPad, yeah. So the goal ultimately is to be device agnostic, so tablet agnostic. And for right now, we're starting with an iPad, and then hopefully subsequent to that, then we're going to extend to other tablets.
Right. Okay. And so basically, you're focusing on the continuum of care and in trying to brush up the lags and the inefficiencies in our current system as a patient transitions from ICU to inpatient to acute care to home care.
Exactly.
And you're putting together an application to help educate these people, patients, right? Your focus is on your clients
Patients
are
and caregivers.
Patients and caregivers.
Patients and caregivers, right? Absolutely, yeah. Okay. Because I mean, as you know, half of the care that these patients are going to be getting at home is, when they get the chronically ill, or because with the support of their caregivers. So we're really also focusing on helping them out as well.
Mm-hmm. And is there any other applications in the marketplace that are already addressing this, or are there? I'm sure there's a lot of changes in digital health and the mobile application, the mHealth industry right now. Like, is your application? Can you talk to us about how that might be different, or talk to us a little bit about that market?
Sure. No, absolutely. So there are apps out there. I mean, if you actually think about it, even online, I mean, the data that we're providing, the information that we're providing, it's nothing new. It's just, like I said, we're reimagining it and providing it in a different way. So we basically have a patent pending artificial intelligence that uses information that's provided early in the admission, and that basically predicts where the patient's going to be and provides information accordingly.
Oh wow, okay. So it actually, they can search for what stage they're at, or how does it recognize where they're at?
So a lot of us basically, when you're in the ER, a lot of diseases with some key elements that are provided, we can pretty much be able to predict where a patient's going to be in their hospitalization course. So it's basically taking our knowledge as physicians and applying it to an algorithm.
So it's basically like there's a standard algorithm or a time frame
Yeah,
that people follow, that if they have a stroke, they're at this point, and then
absolutely,
they go to this
exactly.
point and this point.
Right, right.
Okay.
And then when you have a stroke, for example, if you had an ischemic stroke, you don't really want to learn about hemorrhagic stroke in the early days, right? You
Right.
just want to figure out what's going on. How did I end up here? Am I ever going to walk again? Am I going to work again? Things like that.
Yeah.
So, we really address the questions that the patients and the caregivers have. And as we're doing that, we're providing education. For example, there was a study that was done that showed that 46% of patients that had first-time strokes, when they're discharged, they still don't know what a stroke is, or
Mm.
they don't know how to look out for signs or symptoms of another stroke, or they don't know how to have heart-healthy habits. So that's how fundamental the information that they need is.
Yeah.
And once you establish that, you can start layering on top of it. That also makes the physicians or the nurses' jobs a lot easier, because now they have a foundation on which to provide the additional education during their inpatient stay.
Okay. Yeah, right. And that's just so important, to be educated. I know a lot of people aren't, the caregivers at home, everything like that is just, they don't know. And I think there was a saying I remember in school that we learned, that time is brain when it comes to a stroke. And the more time
Absolutely.
lag that you have between recognizing it and getting them care is vital to their recovery. So I think what you're
Huge.
doing is just fabulous to
Thanks.
educate these people, and just to provide a resource that's just so clear and concise. That's really a wonderful service for them.
Thanks, man.
Uh, yeah, yeah. So are you guys in beta right now, or where are you guys at with
We
this?
are going to be releasing our MVP by the end of the month, hopefully.
Yeah.
If not, first, second week of March. And then basically putting it out into some hospitals that we've already had some discussions with, and do a proof of concept. Really iterate and get feedback, and basically keep putting it out there, and just grow the app from the basic fundamentals right now that we have, in terms of coming in to the ER, going to the ICU, going to the floor, and then going discharge. Obviously, the next additions to that would be, as you pointed out, inpatient rehab, or if they go to a subacute nursing facility, or if they go home, they might go home, and there's a lot of support that we're envisioning to provide.
Right. So is there flexibility within the application? Because you talked about it being algorithmically based and timeline based. I know, from working with a lot of people that have had strokes. I mean, a stroke is such a broad term. I mean, it depends on where the brain gets nailed.
Exactly.
It's like some people have a a quick advance and a quick
Sure.
recovery, and others have a massive, long recovery.
Absolutely.
Does your
Absolutely.
app speak to that?
Absolutely. And that's exactly that was one of the claims that we were able to submit a patent for, is that it uses a lot, for example, the NIH stroke scale, uh, as you pointed out, where the patient is, and where the patient's getting the app, where they're going to, So a lot of this stuff, there's a lot of checks and balances in there. And of course, always, double checking with the patient or the caregiver as well. It's not just a data dump. The whole thing is it's a personalized, um, personalized experience, and it's providing content that's very relevant to the user, to the caregiver. So it's not just gonna say, all right, here we go. We're gonna talk about ischemic strokes and sit down, and it's gonna be class. It employs where the patient is on their health literacy as well. So it starts with the most fundamental elements, like your blood carries oxygen, things that we're not taking anything for granted.
Right.
And then we're allowing the user to really advance at their own speed.
Right.
You know.
Okay.
So and another thing is, I'm sure you saw a lot of this in clinical practice, was, when you tell a patient that they've got any kind of serious diagnosis, be it cancer, heart attack, stroke, whatever, they hear that and then they stop listening. So we proceed to continue to give them education, not recognizing that they're not hearing it or they're not processing it or it's not syncing. So you have to revisit them again and again and again, which is what we do, for example, in the ICU.
Right.
But unfortunately, with the patient burden that's increasing and the workforce that is staying the same, we have less time to do that. Hospitals are cutting. They're doing cost-cutting maneuvers, getting rid of the patient, or sorry, getting rid of the nurses, getting rid of doctors, and actually no, getting rid of patients too, because they're decreasing their length of stay, so they're getting these patients to go out faster. So the time to really educate someone is very minimal now.
Yeah, and they're getting smacked over the head with reimbursement
Sure.
fines and stuff, or readmission rather, fines and problems there, and denials and stuff for like improper readmissions. And
Absolutely,
there's a
yeah,
lot.
yeah. Preventable readmissions, that's a big problem right now.
Right. Okay.
Right.
So boil it down for our listeners then, before we move on to kind of a different topic. Like, what is personal RN and what problem does it tackle in a few sentences?
Yeah. So the problem that we're tackling is lack of patient education or poor patient education and compliance, and we're hoping to be able to augment the educational, enhance the educational experience, so the patient ends up doing better, staying out of the hospital, and obviously decreasing readmissions for the hospital. So it's a cost savings for the entire system.
Right. Right.
Right now, it's a preventable readmissions are $17 billion annually. That's a lot of wasted money.
Yeah. Yeah, and the trends are only going to probably, with the aging population, I'm sure strokes and those things are trending up. Can you just touch on that for a minute, like the overall trend of?
Yeah, well, I mean, you have 30 million new patients coming into the healthcare system with the Affordable Care Act, right? And as I said, the workforce hasn't changed with clinicians. In fact, I just read an article that said that there's a medical school that's shaving a year off their training, because they need to put doctors out faster. There's a shortage of nurses. There's a shortage of therapists. There's a shortage across the board. Yep. So on top of that, we're living longer, right? So now we're going to have more chronic illnesses. We're not becoming more healthy. We're still smoking and drinking and eating Big Macs. So that's a problem. Now, but there's TPA, right? Yep. So the clot buster. So the patient comes in, as you said, time is brain. Patients, their stroke is getting treated earlier, but there's still areas that have been injured, ischemic areas, and so the more people are living longer, but still with disabilities. And as you know, stroke doesn't happen by itself. You usually have hypertension. You probably have a history of diabetes. There's a lot of stuff here, comorbidities, and these things need to play together. A person needs to understand, why is it important for me to keep my blood sugar normal? Why is it important for me to take my blood pressure medicines?
Right. No, it's true. I mean, it's all education and lifestyle. A lot of it is choices. I mean, that's a whole other discussion that we don't have time for today. But anyway, so I know you touched on it a little bit earlier, but I really want to nail this home. So why is your app better than the other ones out there?
Well, like I said, we don't really see anything out in the market right now that really focuses on patient engagement in terms of personalizing their experience and if somebody had a stroke or a heart attack, their resources are what they have to go to. Well, they either get to call their doctor, and the doctor will, call them back in a week, or, the advice nurse. But if they want to look it up right now, they have to go online, or they have to look up in books, or some of the patient handouts they got when they got discharged. So again, what we're doing is we're literally, imagine those patient handouts. You basically have me sitting there highlighting it for you and saying, this is all you need to know. This is what's important to you. So if you can learn this, That's great. That's a win. If you want to learn more, that's wonderful, but let's start with the basics first. That's what we're bringing.
Okay.
Everything else out there right now is just pure content. It's a data dump, right?
Okay. So yours is more interactive then. That's the difference. Theirs is
It's
just
interactive. It's personalized. Exactly.
Okay. Okay, cool. Thanks. Yeah. And so let's see what else. We got a few more minutes here. Tell us a little bit about your personal background and then your team, if you would. I know a lot of people who would be interested in your company might want to know, okay, what's your background and maybe a little bit about the guys you're working with.
Yeah, sure. So, sorry.
A little Red Bull action there, huh?
Yeah, startup fuel. So I'm sure that they should pay me for endorsing that.
Yeah, that was an endorsement there.
So this kind of started with Dr. Steve Kramer. He's over at UCI, and we were talking, and I ran this idea by him, and because it was a lot from my own personal experience when I was in the ICU. I've had 15 years at the bedside, and a lot of times patients would go home and then they would come back, they'd bounce back, and it's not that they'd always come back with these big files and all this paper that we would print for them, and it's not that they didn't want to learn it, it's just they didn't maybe have the same fundamental knowledge that's required to learn some complex medical stuff, right? So and I would find myself, and the way I would speak to a patient who has a PhD is going to be very different than a patient who's never finished high school. So I would customize or personalize how I would talk to these patients based on what I would assess as their background. So that's kind of how it started. Steve came on board because we were going to start with stroke, and he's just a world leader in stroke care. He's an author of Brain Repair After Stroke and an editor, one of the editors on the Stroke Journal. And then along the way, there's a good friend of mine. His name is Alex Sayah, and he has significant background in e-commerce, and he's been in the business world for about as long as I've been in the clinical world. I ran this idea by him. He's had a lot of tech background as well, so he really liked it, and we have a good history together, and we decided to just build this out, move forward.
All right, sounds good. So yeah, we're getting towards the end of our talk then. So just tell us a little bit about, just give us any final comments you might have, and then tell our listeners where we can look up more about you and what you're doing, and then we'll say goodbye.
Cool. All right. So I'm sorry. You wanted a little bit more about digital health altogether?
No, just any final thoughts on your company or anything, and then tell us where to find out more about you, and then we'll say.
Yeah, no, this is very exciting for us. We're in active fundraising right now, and people are physicians and nurses are really coming to really support us. So which feels really good because we're building something that our colleagues want to use. They get it. It's intuitive. So we have a website, personalRN.com. As well, we're on Facebook, we're on Twitter, we're on Instagram, we're all over the place. On Twitter, though, it's personalRN app. And so that's pretty much it.
Awesome. Well, Kourosh, thank you so much for your time and sharing
John.
your story today on the show. All right, everybody. Yeah, no problem. All right, everybody, that was a great talk. I hope you got a good picture of what Kourosh and his team are up to. As always, I'll have these interviews archived. You can go to newwavehealthcare.com/Kourosh Parsapour, or you can simply go to newwavehealthcare.com, look at the past interviews tab, and the latest interviews will just pop right up, and you can check out the archive pages, any resources mentioned here, also links to Kourosh and his projects and himself. So I hope everybody enjoyed that. Have a great day. I'll have another interview next Monday, 4 p.m. Pacific, 7 Eastern. So I will see you guys then.